My role here is I'm a physician and I take care of patients day in and day out. I do interventional pain medicine procedures, epidurals, radiofrequency, spinal cord stimulator type procedures. We treat all kinds of pain. I uh, this includes musculoskeletal pain like low back injuries and knee injuries and shoulder injuries, for example. And also, we treat neuropathic pain, which is a shooting type of nerve pain, or and or reflex sympathetic dystrophy or complex regional pain syndrome type pain, and generally all kinds of pain. We use both interventional procedures to do that, and we use medications to do that. We at Boomerang have one thing I should say that makes Boomerang unique is that we have a large team approach. We have therapists and uh, uh, acupuncture, chiropractors, pretty much everything, every modality. Not that we use every modality for all patients. Some people just need a procedure and they're fine. Other people need a team approach, whatever works. And a lot of times we tend to recommend physical therapy after a procedure just to keep the pain from recurring. One of the things that gratifies me the most about working here and taking care of people is not only the team that I work with, but also seeing patients improve, seeing a consistent improvement in patients, which is really something to see where people start and where people are after a year, especially because the average pain management practice sees patients after they've seen 5 other physicians, 5 to 7 actually. And a lot of times physicians focus on one thing. We try to focus on the whole patient. But again, we're pain specialists. This is really what we do is take care of pain and the causes of pain. And when we can address a cause of pain, that's very gratifying. When I was a small child, I think my father was an engineer, and I think a doctor actually took his parking space or something because he thought I should be a doctor, but I naturally gravitated towards being a doctor anyway. I liked helping people. I liked seeing people uh, healthy, and so when I went to medical school, I gravitated towards pain medicine. It was one of the things I was really good at, and I could naturally connect with people. So that's what I ended up doing. I did some anesthesia, physical medicine rehabilitation for a sports rehabilitation side of it, and then a pain management fellowship, which is actually an interventional pain management fellowship where you learn procedures to do for people. And since then, I've been basically here. This company has actually changed names. We used to be Integrated Pain Medicine or Integrated Pain Management, depending. It was IPM Medical Group, and now we've expanded and we've changed our name to Boomerang. But I've been with this company the whole time, and I'm actually the longest standing employee of Boomerang Healthcare. Um, but I felt it a very gratifying journey over the years, seeing people improve. And sometimes you can't just fix people. Sometimes people have to be on chronic medications, but we really try to address the cause of the pain. I'm passionate about interventions and fixing the cause of pain. Sometimes you can't do that. I'm fine with monitoring people on medications. I enjoy seeing people get better from other aspects of other team members, chiropractic and physical therapy and acupuncture. We also have a functional restoration program, which is very helpful for people. In fact, I personally have sent quite a number of patients to and these patients started out difficult, very dependent on the health system, very dependent on me, and at the end of the program, much less dependent on me. I saw people smile for the first time ever. So I believe in that program. What I'm most passionate about, though, is doing an intervention such as a radiofrequency or or similar intervention and seeing people really improve. Diagnosing the cause of a pain and of somebody's chronic pain and fixing it is very gratifying. Well, there's the medical team, which is myself, nurse practitioner or physician assistants, medical assistants, people that room the patient. Then there's the therapy teams, psychological therapy programs such as the functional restoration program, acupuncturists, chiropractors, and many times people that have been in chronic pain for a long time benefit from seeing other members of the team, other specialties, other treatment modalities. But for the medical side only, it's myself and the nurse practitioner or PA and the medical assistants who I've trained to understand what we're trying to accomplish and what we're doing, which is to address not only the pain, the symptoms right then, but again, the causes of the pain. Cases that stand out to us are the cases where we see something different than we see every day. But the real thing we do is the thing we do every day, which is treating chronic pain with medications and interventions to control it, to let people live their lives, to let people live their functions. Of course, if you're going to ask me my most gratifying case, it's where I caught the diagnosis that all the other people had missed. And there are those, but what we really do every day is what really makes the difference for people. If somebody's on chronic opioids, it although that can control pain, it has all kinds of other side effects. It has side effects of constipation for some people, for a high percentage of people. It has subtle side effects such as depressing certain hormones, the hypothalamic pituitary axis hormones. And so being on chronic opioids, for example, or other chronic medications isn't always what we want. So sometimes we try to transition people away from these medications. And in doing that, we again try to address the causes of pain in general with an interventional procedure. If there's not a simple cause of pain that we can address, then we use a team approach, physical therapy, various rehabilitation programs, sometimes psychological therapy. Sometimes if people get very stressed, their pain gets worse, we can help with that. Right? We can help with acupuncture. We have all kinds of modalities that are available. And now, more recently, there's newer stimulators and spinal cord stimulators and peripheral nerve stimulators and other modalities that we can use that can be very, very helpful. What drives my commitment is seeing people improve over time with consistent treatment, with therapies, with various things. Medications are mainly to maintain their function, but I realize, as they realize, that medications aren't really the cure in general. Medications are to control the pain, and we try to get the root cause, and to see people recover is, of course, gratifying if we can. If we cannot, we can maintain people on medications too. Sometimes somebody has, for example, severe knee arthritis, but they don't want a replacement, or they're not medically appropriate for a replacement. Now, there is a procedure, a geniculate ganglion block, certain types of blocks we can do for knee pain. Let's say we have those. Let's say they're not a candidate for those, or that doesn't work, or it's been tried. We can maintain people on medications as well. Braces. There's all kinds of things we can do, but sometimes we just have to maintain people on medications. There's nothing else. I think what excites me the most at this point is the regenerative medicine aspects of care, to put in not just platelet-rich plasma, which is, of course, can be very helpful, but also stem cells in general can actually regenerate certain tissues, certain tears, and that's quite exciting. It can actually fix somebody without a big surgery. Eventually, and this isn't here yet, I'm hoping that there's a discovery to regrow cartilage, which would save a great deal of replacements of shoulders or knees or hips. That's in the future. That's not here yet. But the fact that people are exploring and there's a great deal of interest in stem cell treatments is potentially very exciting and new. I have a lot of team members, and we're a comprehensive center, and that's what we're trying to do.